We're touring because Australia is hosting the G20, and whilst the G20 are here, they're going to be talking about the global financial situation, and they're going to be focusing on how the G20 countries can recover from the global financial crisis. To remain silent will see our way of life eroded here in Australia. We believe that there's a practical and relatively easy solution.
There are alternative choices to the ones that the government intends to be undertaking. We know they can raise the money for public health care and other important public services if they make the right decisions. One decision is to close the loopholes enabling tax avoidance. The other is to introduce a Robin Hood tax here in Australia. Instead of shifting our public health services further down the track of an Americanised two-tier health system, a Robin Hood tax would help fund the continued delivery of equitable, universal public health care for all Australians.
The Robin Hood tax is about evening up the tax system and getting the bigger end of town to pay taxes which often they manage to avoid.
It's a minuscule amount, but because there are trillions of transactions, that in fact adds up to quite a lot of money.
We do have a better, fairer country when everyone has equal access, universal access to health care, no matter what they have in their hip pockets.
The Medicare co-payment, increasing the amount of co-payment for the PBS would effectively impose a bigger tax on the poorest in society, the people who can least afford it. This tax would only hit the big end of town.
It will not only raise revenue but help stabilise the financial markets. That would be a wonderful thing.
Working on 0.05% in Australia would look at, say, 12 billion over 4 years. The problem is the lack of political will or commitment to the tax.
It is time for Australia to contribute constructively to international discussions regarding an effective financial transactions tax.
Hopefully all the people that were here, even if they go and talk to 10 people and those 10 people then start talking about it to other people, the word will spread.
The Robin Hood tax. I mean, this takes away that pressure. This keeps Medicare. This puts money back into the health system, into things, education, things that we might need.
One of the things they're discussing in order to achieve economic growth is cutting public services and government-provided services. And to do this, they like the idea of privatising them.
In the United States, healthcare is not a human right. You don't expect to get health care unless you can afford it. We are ground zero for why a public system is necessary and why a privatized system does fail in the end.
Delivering universal health care is a fantastic way of increasing productivity in any country.
Yeah, we've been advocating for the Robin Hood tax in the US for the last several years. And we find it actually, it's an idea whose time has come. These are the high frequency trades on the microsecond that really buying and selling, it's the casino economy. The reality is that 40 countries around the world have some form of this tax. Hong Kong exchange has the tax. France has the tax now.
How better things could be if we could access a fairer slice of the pie through increased revenue from the people who can most afford it, instead of a GP tax that might come from the people who can afford it the least.
What you've heard about the Robin Hood tax tonight encapsulates just what is needed, a much fairer means of how the government collects its revenue and how it distributes these shared resources.
Bring the Robin Hood tax to Australia.
We can't afford not to have a strong universal health system around the world, and we need to fund it properly. And what we're calling for in our forum today is to look at the introduction of a financial transaction tax, a very small amount on all of the transactions that occur in the financial world, which will go towards funding essential services like health and education.
As nurses, you are doing far more than most to make life equal here in Australia and overseas.
Why do nurses care about the Robin Hood tax, as if we're nurses just fluffing up pillows in the hospital, and that our own political commitment to making sure that our communities better doesn't stop at the bedside. And this Ebola epidemic is really highlighting what's really wrong with our public healthcare system globally.
And my G20 message to you, Tony, is hands off our health system, hands off Medicare.
This is going to be a hard battle to win. We know that there's massive opposition to any discussion about tax.
You cannot grow an economy that is sick or is full of sick people who do not have access to health care.
Very proud to be part of this flotilla of nurses that have come all the way up the south coast of New South Wales, through the north coast, central coast and up to Brisbane here to lobby our leaders for the G20.
So the Nurses of Australia organised this boat trip to pass in front of the G20 to give them a very strong message. Yes, we're here to make sure that public health care is well financed worldwide. And how do we do that? It's through a Robin Hood tax.
Give us a cause, something as important as funding public health properly, and we will do anything to make sure that, in this case, world leaders understand our message.
We're shouting, hey G20, the Robin Hood tax, fund public health, and the message was really well received by people on both sides of the bank. People were waving and cheering us on. Even the police got into the act and started responding to our requests for support for the Robin Hood tax.
Look, I think this was a fantastic way of sending a message to the G20 leaders. We were right in front of the building. We're pretty confident we saw them poking their heads out at the morning tea break, and we were there, we were yelling. They definitely heard us, so there'll be no excuse for them not discussing a Robin Hood tax for Australia's future.
This has been a great culmination to the end of the road trip for the New South Wales Nurses and Midwives Association. It's been a great global effort. Nurses from across the world, Canada, US, Nigeria, all here supporting the introduction of a Robin Hood tax. Clearly we've got our message out, but more talk has to happen.
We are going to keep the pressure on until we get the Robin Hood tax everywhere.
Tax, feared by the bad, loved by the good.